Hello, I'm Emma O'Dowd. I'm a doctor and medical researcher. The work I do is aimed at finding ways to improve the experience of being a lung cancer patient.
My name's Dr. Helen Morgan. I'm a respiratory registrar who was training through Nottingham. The Decline project is an idea that was generated by one of my colleagues and supervisors, Dr. Emma O'Dowd. And the idea is that we want to identify those patients who aren't having treatment for their lung cancer for whatever reason and find out why they're not having it. So we know from the National Lung Cancer Audit that unfortunately there's up to a third of patients who have early stage lung cancer, which is the cancer that we can hopefully cure, who don't have the curative treatments that we could offer. What we don't know is why they don't have these treatments, what barriers the individuals are having that are stopping them from accessing services that they need.
What we thought we really needed to do was go out and talk to people and find out what it was, because we're desperate to offer people who can have treatment with a cure. And if there's something that we can do to try and make that easier or to break down some barriers, I think that's where it really came from. So the idea is that we will go out to some of the trusts. So in the East Midlands, we have some rural hospitals, we have some city hospitals, and just try and unpick what the different barriers are and what people think about treatment. Is it that they're scared? Is it a practical barrier like transport that we could look at?
So from some work that's already been done by different teams across the world, we know that there are some patients who are just don't want to engage with healthcare services. They are scared, which is completely understandable, and they don't want to have to keep coming back to a hospital. They don't want to worry and that stress, and so they don't want any treatment.
I think there is a lot of fear. There's a lot of stigma still, I think, surrounding a diagnosis, and there's probably a lot of maybe lived experience where someone has seen a family member maybe 20 years ago going through what was then very different treatments, and perhaps the fear of what the consequences or the side effects of those treatments might be is something that is in their mind, and perhaps trying to break down those barriers and explain how much things have changed as well is something that certainly Roy Castle does very well, trying to make it understandable to people. But maybe as a medical profession, we need to look at the way that we're talking to patients and explaining things as well to try and help them to understand things.
So what we need to do is speak to individuals, speak to people from different areas with different backgrounds and find out what their barriers were, so that hopefully we can come up with ways to stop those barriers being an issue for other patients in the future.